Hi guys, in this video we're going to talk about the histology of the female reproductive system. We're going to talk about the ovarian cycle and what happens in the ovary, and we're going to talk about the uterine cycle and what happens in the uterus, and then we're going to talk about the uterine tube and briefly about the cervix and the vagina. Now, this is your ovary. The ovary is composed of two parts. It has the cortex, where you get to see the follicular cells and the growing follicles and what happens to them from the time they start to develop all the way to the time they undergo atrophy. And it has the medulla that houses the blood vessels, lymphatics, all right, and this is the connective tissue. So this is the medulla, okay? So this is the medulla, and then the cortex is where you have all the cells and what happens in them. Now, the story starts with your follicles. The follicle houses your oocyte. You have the primordial follicle. So the primordial follicle is how you start to develop the oocyte and the follicular cell and get it all the way until it's ready to get into the tubes and to get fertilized. So the primordial follicles, because they are primordial, it's where you're gonna store it. It's composed of simple squamous cells. Okay, the follicles, there is a classification in histology is that we classify organs based on the functionality of the organ. We have parenchyma and we have stroma. So if what we're talking about is something related to the cells that are doing the function of the cell, which in this case is developing the oocyte, because this is an ovary, and the reason why we have ovary is to reproduce. So the reason why I have everything here is to develop this oocyte and get it ovulated all the way until it gets to the uterus and it gets fertilized. So the parenchyma is basically your the follicle itself, and everything happens inside that follicle. However, the stroma is the connective tissue, the supporting tissue, that everything around you that helps you to do the function you need. So we have the parenchyma, which is all of these growing follicles, and you have the stroma, which is all around you. The cells that are all around you are what we call the stroma. Now, it starts with the primordial follicle. At the start of the process, we have the FSH, the follicular stimulating hormone, and it stimulates the follicle. So I have primordial follicle. It was at the beginning simple squamous cells, all right? So very flat cells, very inactive cells. These follicular cells will be stimulated and they will start to grow. They will become cuboidal, and once they become cuboidal, one layer, we call them primary follicle. So the primary follicle is when the primordial follicle start to get active, and those cells become active and cuboidal, and then they will start to give by mitotic division many more cells, follicular cells. So we get more into multilaminar primary follicle. So at that point here, we are still cuboidal cells, we are still primary follicle, because we are getting more cells and more cells. These cells will start now to secrete fluid, and that fluid is what we call the liquid folliculi. It's a follicular liquid fluid, and that because of that fluid, there will be rearrangement of the cells, and these follicular cells are actually going to be called after some time granulosa cells. It's nothing but the follicular cells inside the follicle, and they will start to get rearranged. Once you guys see that you have fluid somewhere and your oocyte is starting to grow, and then you're trying to regroup this granulosa cells, we're gonna call it the antral follicle. Once you start to get this antrum, which is the fluid-filled cavities inside the whole thing, we're gonna call it antral follicle or secondary follicle. Once you get them grouped, the granulosa cells, into granulosa cells everywhere and corona radiata, which is what corones, what is surrounding the oocyte, and some connection between the oocyte and the surrounding granulosa cells and the other ones, once you start to see this arrangement as your granulosa cells is grouped into three groups, regular group here, the granulosa cell and corona radiata and the cumulus or ophorus, which is important for the communication of your growing oocyte and the follicle itself, we're gonna call it a mature or Gravian follicle. Means now we are mature, we are the Gravian one, it's ready now, almost ready to get ovulated. All right. Once you get into that point, it means you're ready. Now you'll start to get plasmin from the ruptured capillaries around you. You'll start to weaken the ovarian wall so that under the influence of LH, sorry, under the influence of LH, at that point, you will start to have the ovulation, the oocyte, everything here gets weakened. The oocyte comes out with the surrounding corona radiata around the oocyte, and this corona radiata is all around, and there is a layer of membrane called zona pellucida. I'm going to see that in a while, and that corona radiata is going to cushion the oocyte and protects it as it comes out from the ovary, and then by the movement of the fembria with the current, we're going to create by the peritoneal fluid, we're going to suck up the oocyte, getting it into the uterine tube, and it rests there for 1 day to get fertilized, or 2 days in the ampulla, right? So this is a uterine tube, this is the fembria, the infundibulum, the ampulla, and then the isthmus, and then you suck up this, and this is why also the peritoneal cavity is not closed, it's not a closed serous sac in the female, because this is the opening we get. It's basically in order to make it easy for us to suck up the oocyte from the ovary and get it to the uterine tube, and then it runs here all the way until it gets into the uterus. All right. And if there is a sperm coming from here, they will meet up at the ampulla, the most wide area, and the uterine tube, and then it gets fertilized. Once we get the oocyte out, it's going to become the corpus luteum, which is a secretory organ, and that is what secretes the progesterone and estrogen, which is important for the uterus, because this is going to prepare the uterus to have more and more thick endometrium to receive a fertilized egg for the embryo. So at that point, the corpus luteum is a steroid secreting organ or gland, let's say. And because of that, because it's a steroid, it has lipids, we call it luteum, right? So the corpus luteum is basically yellow in the normal status. So that's why we call it corpus luteum, because luteum means in Latin yellow. And it will start to secrete the progesterone and estrogen. And how is it actually formed? It's basically by the granulosa cells, and the granulosa cells from inside the follicle and from the stromal cells. We have stromal cells all around. Remember when we said the parenchyma and stroma? The parenchyma part, which is the granulosa cells, and from the stroma side, we will get two layers, one theca interna and one theca externa. The interna is the vascular one. The interna is the one that is going to help the granulosa together to secrete the progesterone and estrogen. Okay, and these are the cells that are going to eventually give you the corpus luteum. However, outside the theca externa, it's basically fibers. It's a fibrous layer. It has more fibers than cells, and it does not participate in that thing. So the theca interna cells and the granulosa cells together are going to then, when we bring the oocyte out, together they are going to form the corpus luteum. And then once it's done its job, the corpus luteum is going to become connective tissue. It's becoming atrophied now, replaced with connective tissue, and that connective tissue is white in natural settings, and that's why we call it corpus albicans. and Albican means white in Latin. All right, so this is the cycle from the time we start to choose the follicle all the way until we get the oocyte out from the Gravian one, and then the remnants here, which is the granulosa cells. We call them at that point granulosa lutein and theca lutein. These are the ones that are going to produce and secrete the estrogen and progesterone, which is very important for building up the uterine wall. And if there is pregnancy, the fetus or the baby is going to secrete the human chorionic gonadotropins that is going to tell the corpus luteum, please stay there, keep on secreting the progesterone, keep on building up the uterus, because I am a baby and I want to implant myself here, and I'm not ready yet by the placenta of my mom to take care of the progesterone that will maintain the endometrial lining. So stay there for 3-4 months until the placenta is fully developed, and then you can degenerate at that point. So in that case, if there is pregnancy, we call it corpus luteum of pregnancy, and it stays for a longer time. However, if there is no HCG um, at the time of the menstruation, it's going to transform into the corpus albicans, and it will stop producing progesterone, and there will be a drop in progesterone. And once we sense the drop, the menstruation is going to occur, and we're going to shed the lining of the endometrium because we don't need it if there's no baby. So again, this is a picture that shows the primordial with the simple squamous cells in its inactive status, and inside that you have the oocyte. And then moving on to cuboidal cells, this is the primary ovarian follicle, and once these follicular cells give the fluid and get arranged, that's gonna get you to the secondary follicle. And once you arrange it, the granulosa cells, in such a way that you have a lot of fluid, and making the granulosa cells, the corona radiata and the cumulus oophorus, means this is the mature, you are ready now to ovulate. And once you ovulate, the granulosa cells and the theca lutein cells are going to give you this endocrine organ, and that is going to produce the progesterone and estrogen. This is the corpus luteum. And then once it's done its job, and it becomes replaced with connective tissue um, structures, it loses its ability to produce the hormones. It's gonna become atrophied, and it's gonna be replaced by the corpus albicans. And remember that the zona pellucida I told you about, which is what surrounds the oocyte, and it's between the oocyte and the corona radiata. Here is during ovulation, all right, and this zona pellucida is important for the acrosomal reaction and activation of the sperms in order to get to fertilize the egg. And it's also gives protection to the oocyte itself, and it prevents the oocyte from getting fertilized by more than one sperm. So that's why zona pellucida is very important. Now, as we proceed, you guys can see the uterine tube. This is a cross section. It shows you the layers of the uterine tube. It's formed by mucosal lining, and mucosa means I have an epithelial cells and a core of connective tissue. This is what we mucosa mean. It's very, very highly folded mucosa. You guys can see a lot of mucosal folds filling up the lumen of the uterine tube. All right, because it's a lot of here. And if you look at the core of these epithelial cells, this is going to be your connective tissue or lamina propria. So if you guys look at the cells of the uterine tube, it's formed by two cells, and structure explains function. I have the secretory cells, and I have ciliated. Why do I need big or secretory cells? Because I need to produce a mucus, and that mucus is important as nutritive function, protective function, lubricative function to the oocyte. All right, so I need to have this cells to secrete this mucus in the tubes. Why do I have ciliated? Because I need to help in pushing the oocyte in the tubes, all right, all the way from the end of the tube to the uterus. All right, so this is why I have that. And if I have a cross section at the level of infundibulum or ampulla or isthmus, what's gonna happen is that gonna be a change as we come near to the uterus. What do you expect that change to be? Of course, think about it as structure explains function. First of all, the lumen is gonna be narrower. So the lumen is gonna be narrower. Why? Because at that point, I'm trying to get the oocyte and I'm trying to fertilize the egg and I'm trying to have enough space to suck up this oocyte and have it housed in my place. But as I get into the uterus, I don't need that space. It's already there. I already took it from the ovary and I don't need it to be there. It's already there and it's already moving into the uterus. So the lumen is going to become narrower. The mucosal folds are going to become less also. Why? Because mucosal fold, a lot of folds, it means I need a lot of cells. And there, I need the cilia because I need to help to guide the oocyte into the uterus. I need mucus more because I need to help again to push it to the uterus. But as you proceed, you don't need it anymore. So the folds are becoming less. All right, so the lumen is getting less, the mucosal folds are getting less, but the muscle layers are getting more because now you're gonna blend with the uterus, and the uterus has a thick mucosal, muscle layer, and you're getting into the intramural part. So you need to come from a very light organ here that is hanging everywhere, trying to suck up the oocyte, and light in its weight, getting into the structure that gets into the big organ. So of course the muscle layers are gonna get more. So these are the changes that's going to happen in the uterine tube from the infundibulum part all the way to the isthmus or intramural part. So here you have the mucosal line, the mucosal folds in the lumen, and then you have the muscular walls outside. So you have inner circular, outer longitudinal, and then you have in the mesosalpinx, the connective tissue all around you. You have the blood vessels, lymphatics, arterioles, venules, and everything outside you. All right, now moving on to the uterus. The uterus has three layers. All right, so the uterus has the endometrium, which is the one that has cyclic changes. It has two layers. It has functional layer and it has basal layer. The functional, from its name, it depends on the function. If I need it, if I'm building up the uterus and I need it to carry out the function of the uterus, which is to receive a baby, I'm gonna have it. If I don't need it, it means there is no baby, I'm gonna shed that layer. But basal is the basic of that endometrium, so it should be always there. And then I have the myometrium, which is the three muscle layers of the uterus, the next layer. And the last one is basically the perimetrium, which is peri means surrounding, which is the connective tissue layer that surrounds the whole organ. Now, talking about the functional layer and basal layer, you guys need to know that this is the one that we get to have it as we build up the endometrial lining from day 1 to day 4. This is menstruation. All right, here you are shedding what you've been building up previously, and then from day 5 to day 10 in the proliferative phase, you are building up more and more of your epithelial cells and the uterine glands, and more building up, getting blood from from you have the uterine artery getting into the uterus, and then it branches off until it gets you this spiral artery. The spiral artery can grow more into that layer and giving many branches, and that branches will help in giving more blood supply and proliferation of the epithelial lining of the functional layer, and that is being under the influence of the progesterone and estrogen. Remember, guys, when we talked about the ovary, all right, so the whole story starts with the ovary, and once you get the thecal lutein and granulosa lutein cells done, by day 14, sorry, not day 14, but day 5 to 10, you start to get the estrogen and progesterone, and you start to build up this functional layer, and the uterine glands are going to become more and more. And after that, from day 11 all the way to day 28, you have the secretory phase. It means you have the glands ready, you have so many coils of blood vessels, and you are going to secrete more and more of urine glands because you are nourishing the area and being ready to receive a baby. And once the baby, the oocyte comes to the uterus unfertilized, it means there is no baby. You will start to get negative feedback. Progesterone is not going to come anymore, and then you're gonna shed off this functional layer and start your um, menstruation. All right. So based on that story, try to relate that to the histological sections. If you guys look at the menstrual phase, it means that was the secretory phase, but there is blood coming out and there is shedding. Can you guys see the outermost layer of the endometrium? I cannot see a complete layer because there is shedding and what we can say, um, um, degeneration of the topmost layers, and blood is everywhere. All right. And the urinary glands look like the previous stage was the secretory. It was ready with everything, but blood is getting everywhere, and you're shedding off that. And as you get to the proliferative phase, here you're starting to get progesterone and estrogen. You're starting to have more new straight glands, but they don't have secretions, and they are not very well developed, and the thickness is just 2 to 3 millimeters. Still, you are trying to build up this layer. You have a complete layer of epithelial lining. It means this is the proliferative phase. And after day 10, when you're becoming very active, now you have this corkscrew appearance of the glands. Look how the glands are very active with irregular lumen, and even the lumen is filled with urine secretions. Can you guys see the secretions inside the lumen? Can you guys see how it looks like? Can you guys see how thick it is? Now it's ready for the baby. This is your epithelial lining. You have your coiled arteries everywhere, and the thickness of the epithelium is reaching up to 5 millimeters. I'm explaining here for you guys the basic concepts of the histology, and you can just Google and look at many histological pictures, but I see this is showing the typical features of the histology of the female reproductive system. So I decided to show you these pictures, and you can go ahead and watch any pictures in any microscopic picture. Things will be very easy after you understand the concept here. Okay. So this is the idea of the uterus, and following the endometrium, you have your myometrium, and you have your smooth muscles of myometrium, and the last thing would be the perimetrium, which is not showing here. It's basically your um, um, the layer of the peritoneum and how the blood vessels are running into that. Now, the cervix here is undergoing a transition because we were in the uterus, and that was glandular epithelium. We had so many glands. Look at these, how they look like flowers, and the epithelium was simple columnar epithelium, which is a typical epithelium of any active gland. And as you proceed into the vaginal part, the vagina is actually a copulatory organ where there is friction, and there is we need to prevent abrasion, and we need to prevent damage to the layers. So the epithelium is going to change into stratified squamous epithelium that gives you this pink color with all these dots. All right, this is the stratified. It means a lot of layers are here, and because they are a lot, they are losing, you cannot see anything other than the dots of the nuclei of the cells, because this is a stratified layer, a squamous epithelium. And here this is following the uterus with the simple columnar epithelium. And sometimes, because the cervix has glands and they secrete also secretions, you can get to have some Nepothian cysts trapped. Sometimes they don't find a way to secrete the fluid, the mucus outside of the organ. They become trapped, and in that case, they form glandular cysts. Um, which is it's okay. It's not it doesn't have any pathological or any a problem, but you can get to see those cysts there because cervix is one of the organs that secrete mucus. However, but vagina does not have glands as there is in the cervix, right? You can occasionally see some lymphatics in the vagina, and this is, of course, it needs to be a lot because this is an organ that is facing a surrounding, and it's receiving the penis, and it has communication with the surrounding environment. So there should be lymphatic tissue to protect the organ from infection. And of course, it's a stratified squamous epithelium because this is an organ that is vulnerable to damage and abrasion, and we need to protect against damage by having a lot of layers to protect itself. With that, we are done with the histology of female reproductive system. Thank you guys for watching. Don't forget to like and subscribe, and see you in the next concept.